Hello, everyone. Good afternoon. Welcome to another Facebook Live session of Ask Your Asian Eye Doctor. I'm Audrey, and this afternoon we'll be discussing drooping of eyelids and blepharitis. So, drooping of eyelids is a common concern among our elderly patients, especially those who undergo cataract surgery. Even after a successful surgery, a number of them can complain that they still can't see well, and sometimes that is because their eyelids are drooping. So, joining us this afternoon to explain why this happens and what can be done to treat it is Dr. Kleiner. So, Dr. Kleiner specializes in oculoplastics, which is otherwise known as eye plastic, lacrimal, and orbital surgery. He completed his medicine degree, internship, and residency training at UPPGH Manila, and then he underwent fellowship training in ophthalmic, plastic, reconstructive, and orbital surgery in two hospitals. First, at the University of Cincinnati Medical Center in Ohio, USA, under Dr. Dwight Cohen and Dr. Robert Kirsten. And second, at the Kantonsspital Winterthur Augenklinik in Switzerland under Dr. Martin Hatt. So, aside from that, he's the current head of Plastic Lacrimal and Orbit Service of Asian Eye Institute and the Rizal Medical Center. He also established and launched the Oculoplastic Fellowship Training program at Rizal Medical Center and at PGH. And he has since trained a total of 7 oculoplastic specialists in the Philippines. He's also held several notable positions, and that includes being the former president of the Philippine Society of Ophthalmic Plastic and Reconstructive Surgery. He's also the former chairman of the Department of Ophthalmology at Rizal Medical Center, and he's also the former chief of oculoplastics at UPPGH, and also the founding fellow of the Asia Pacific Society of Ophthalmic Plastic and Reconstructive Surgery. Good afternoon, Doc.
Good afternoon, Audrey, and good afternoon to everybody who's watching or listening.
Okay, Doc, so before we start and get into our discussion, can we discuss oculoplastics? It's an interesting branch of ophthalmology, so we want the viewers to understand what it is and what eye condition it treats.
Right, so oculoplastics is also known by its longer name, that's ophthalmic, plastic, and reconstructive surgery. Okay. Now, in ophthalmology, as you know, ophthalmology is our specialty, which is the study of the eye and the orbital adnexae, or the supporting structures around the eye, no, like the eyelids, the orbit, and the lacrimal system. And the eye is such a small part of the body, but it's divided into many parts, and each part has a subspecialist. Okay, so like we have a subspecialist for retina, we have a subspecialist for glaucoma, we have a subspecialist for cornea, and our subspecialty is called oculoplastics, and that is the study of the eyelids, the orbit, and the lacrimal system. So the orbit is the bone that surrounds the eye, and the soft tissue that surrounds the eye. So that's basically the scope of oculoplastics.
Okay, and then Docs, more specifically, what do you mean when you say drooping of the eyelids?
Okay, when we say drooping of the eyelids are really getting in the way of the visual axis. Okay, so when we say the visual axis, that is the path of the light as it enters the eye. And so, of course, if the eyelids are drooping down, they can cover the passageway of the light, and they can cover the light. So that interferes with vision.
Okay, so Doc, in this particular photo showing on the screen, like you can tell the eye of this particular patient, parang yung balat nga, it's covering a lot more of the eye itself. So you're saying that with this kind of condition, hindi nakokontrol ng tao yung pagbukas ng mata niya, parang yung balat is really just kind of covering the eye.
Well, there are two possibilities when we say drooping. It could just be the skin that is drooping down, but actually the eyelid is open. But then because the patient has a lot of skin, or maybe the eyebrows are coming down, and that adds to the skin, and so the skin might be covering the visual axis. And we call that blepharospasm. In other words, there's excess of skin.
Mm-hmm.
But like the one in our picture, um, you could see that it's really not the skin that's covering, but actually the whole eyelid is really lower, and
Ah, I see.
that
Okay.
that one is called ptosis. Okay, that is true drooping of the eyelid, and
Okay.
um, it's really because the eyelid is drooping down and the opening is much smaller.
Okay. So I can see na for someone like that, I can imagine how difficult it must be to see. Na parang feeling nila parang they have to push it up just so that they can see clearly. In
Yes,
this
that's
case,
what most people have to do. They have
mhm.
they have to manually lift it up.
And then Doc, if the upper lid can come down, does that mean the lower lid can also droop?
Uh, yes. If we don't call it drooping in the lower lids, we can call it eye bags. Okay,
Ah,
because as we get older, the tissue around our eyes um, become lax or loose, and so the skin can droop down in the upper lid, but in the lower lid, the fat is there's more fat around the eye. The fat sort of comes forward, and you can see that you develop eye bags. Okay, so yes, but we don't call it drooping. The
it's just
changes with aging is actually more of eye bags in the lower lid.
okay.
Sometimes they do
So,
become loose, and they would need some tightening as well.
okay. So I
So
can see that
in
also
this
in that
picture,
photo, Doc. Mm-mm.
yes. So in this photo, you can see that the patient really has a significant amount of bags in the lower lid, as well as skin coming down from the upper lid,
Mm,
and removal of the skin and in the upper lid and the fat in the lower lid relieves or his symptoms and problems.
okay. And then, Doc, I remember you mentioned a little bit earlier about what one of the reasons that this happened. So, just for the benefit of the people watching us today, what is it that really causes yung pag-droop ng eyelids? You mentioned kanina it could be a problem with the skin, but it also could be a problem with the eyebrows themselves.
Yes, sometimes the eyebrows can come down also, and we call this drooping of the eyebrows or brow ptosis. And sometimes we need a procedure to lift the eyebrows back up in order for
Mm,
them to see clearly again. So, um, so yes, the skin is one problem, and the other problem would be the muscle.
okay.
Okay? So,
So it
if
depends.
right. So if we're going to talk about the muscle, there are also three types of problems with the muscle. Um, our eyelids have a muscle that pulls the eyelid up, and that's called the levator muscle.
Mm-hmm,
Okay.
mm-hmm.
So when there's a problem with this muscle, then you can have drooping. Okay. So the muscle could be weak, okay, or the muscle could be detached, okay.
Okay.
The muscle could be strong but actually detached and come down, or the muscle may sometimes be a little bit weak.
Mm-hmm, mm-hmm. Doc, can it also be related to a lash problem?
Yes, actually, um, together with the aging, usually with some aging, um, our the tissue around the eyes become very lax, and together with this, the eyelid can become unstable. So the
Mm-hmm.
eyelid can sometimes turn outwards or it can
Mm,
turn inwards. And when that happens, then you get what we call an ectropion if the eyelid turns outwards, or an entropion when the eyelid turns inwards. Okay. Now here, for example, this particular patient does not really is a young patient, but she has the problem with her is that the eyelids are uh, there's an extra roll of skin on the
Mm-hmm.
lower lid that sort of pushes the the eyelashes inwards, and this can be remedied by removing a little bit of skin and muscle in the lower lid. So if you will notice, it's a little bit difficult to notice, but you can see with the picture in the lower portion, the lashes have already been turned outwards after
Mm-hmm.
surgery.
Okay, okay. So so it's not just a matter of the skin or the muscle that's having a problem. It could also be a matter of having your lashes turn inward or outward that can be causing some discomfort in patients.
Yes. And sometimes it's not just the lashes, but the whole eyelid itself would turn inwards, or the whole eyelid itself would turn outwards. And this is more common in the elderly.
Mm-hmm.
Um, and together with the blepharoplasty, we can do a tightening procedure. Sometimes we need to tighten the eyelid up here in the corner, and
Mm-hmm.
sometimes we need to tighten a little muscle down below in order to recreate the stability of the eyelid.
Okay. So so when it comes to treating yung upper eyelid or about the eye bags, it really depends. Tightening yung dot of the upper eyelid, that's the blepharoplasty. Is that correct, Doc?
Yes, we would need to evaluate your eyelids in order to determine what is really causing the drooping. Okay, so like I said, sometimes skin is the problem,
Mm-hmm. Mm-hmm.
and sometimes it's the muscle that is the problem.
Okay. So, Doc, kung ganon, kapag yung lower eyelid naman yung problema, sa upper eyelid, pwedeng blepharoplasty yung treatment. Kapag lower eyelid, it's also a kind of blepharoplasty, pero specifically for this area. So,
Yeah,
ang pwedeng mangyari dun, Doc, we'll remove not just skin, but also muscle, like in the photo of the patient previously. Uh, And then kapag merong problema dun sa lashes naman, so kailangan rin i-adjust mismo yung lid, whether it's the upper or the lower, para siguraduhin na yung pag-turn niya is correct. Yung saktong paglabas lang, hindi siya sobra sa ectropion at hindi siya kulang, which is entropion, yung paloob naman. Ganun usually, Doc, yung nangyayari.
yes, yes. We have to, but all that is done during the operation, no?
Mm-hmm.
So we just have to. Usually, we are stabilizing the eyelid, no, with sutures
Mm-hmm.
or tightening the muscle. Okay, and in some cases, we need to remove a little bit of skin and muscle as well.
Okay.
These things and all the adjustments are done during the surgery.
Okay. And then, Doc, kanina kasi binanggit nyo na parang tatlo yung posibleng problema dun sa levator muscle, which is causing the ptosis, right? Yung sa pag-droop ng upper eyelids. So, pwede siyang muscle fatigue, pwede siyang muscle weakness, or muscle detachment. So, Doc, if we're talking about yung muscle fatigue, I mean, is there something that causes the fatigue?
Well, if we talk about muscle fatigue, usually there is a cause for that, and it is called myasthenia gravis. No,
Uh-huh.
in myasthenia gravis, it is a type of disease of um, the it occurs at the junction of the nerve and the muscle. Diba yung the way the muscle moves kasi is we have a stimulus from the brain. So the brain sends a message, and that message passes through the nerve. Okay,
Mm-hmm.
and that nerve um, passes that message or impulse to the muscle. So between the nerve and the muscle, there is a chemical there that
Mm-hmm.
allows the nerve or the message to pass to the muscle.
Okay.
Okay, and that is actually it's actually a chemical neurotransmitter which is called acetylcholine. And in Myasthenia Gravis, there is a shortage of that neuromuscular um, uh, chemical, no? So, nauubos yun eh. So with the constant
Mm-mm.
stimulus, that chemical nauubos na. And that's why the muscle does not move or becomes fatigued every weekend.
Okay.
Okay, but
Okay.
then after
Okay.
just a short period of rest, the body is able to reproduce that chemical again. And so the next stimulus, parang bumalik na naman, gumagalaw na naman siya ulit. Okay,
Mm,
so there's some fatigue there, no? One of the tests for myasthenia gravis is to look up continuously for 1 minute. And if the patient has myasthenia gravis, by the end of that 1 minute, hindi na niya ma-maintain yung eyelids niya mataas, makikita mo, it will gradually start going down, 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 down. And that's what we call muscle fatigue.
I see.
Okay. But then when the
I
patient rests again for a
see.
little while,
Okay.
it will open up again. So that is the hallmark also of myasthenia gravis is a variable ptosis. May times na nagdudroop siya, may times naman na nakabukas siya, no? Hindi siya lagi nakababa.
May times na hindi.
Okay?
Oo.
Oo. So, so
Okay.
that's
And then
what
for
we
a
call the
condition like
muscle
that,
fatigue.
Doc, how is it treated?
There's a treatment for
I
that.
mean,
There's a
does that
test called
have
the tensilon test, and
to
if
be surgery
that's positive,
immediately? Is there something else?
yeah, there are actually some
Mhm.
tests for that. No, you have the nerve conduction test,
And
the
then, can I
tensilon
take
test.
medication for
So
that?
those can be done by a neurologist. And yes, and then the actual treatment for that is the mestinon. So you have to take. There are oral medication or tablets that you can take, and that will relieve the problem. So talagang may cure para diyan. Um, so well, the next problem naman with regards to the muscle
Okay.
is
And then, Doc, that's good to hear actually
yes,
since hindi naman siya continuous.
yeah. I'm sorry, Audrey, I didn't catch that. So well, I think Audrey. Well,
So, Doc, you were gonna
maybe
talk
we'll
about yung muscle
continue
detachment.
talking
So,
about
posibleng malakas yung muscle, pero detached lang siya.
yes. Sometimes the muscle is actually very strong. No, there's nothing wrong with the muscle. It's quite strong. And what has actually happened, especially in some of our elderly patients, the muscle has actually detached from the eyelid. And all we really need to do during surgery is to look for the muscle and reattach it back to the eyelid. And then the eyelid will start moving properly again. And so this is a very common condition that we that we that we perform the surgery for, no. Um, and yet another problem is if the muscle is actually weak, no. It's important for us to test the strength of the muscle before we do the surgery. If the muscle is very weak, then sometimes there is no eyelid crease, okay, and sometimes the the eyelid does not lift up properly, no, because the muscle is very weak. Usually, this is more common in congenital conditions, no. So yung mga inborn na mga patients born with the drooping eyelids, no? So this is usually congenital in nature. So like as you can see here in this picture, we have the patient with drooping eyelids, and because the eyelids or the muscle is very weak, what we need is a sling. Okay, so we can insert a silicone sling, or sometimes we use fascia lata from the leg, or which is like a tendon from the leg, and use it like a thread. So you can see here in the second picture, in the middle picture, you can see how the silicone or the fascia lata is threaded through the eyelid and suspended to the brow. So what happens is we're suspending it. We're actually suspending the eyelids upwards, no? And so here in the lower picture, she has a very good result. No? Her eyelids are nice and open, and you can see the reflection of the light in her eye, which means that the visual axis is no longer compromised.
Yes.
Yeah.
Okay.
Okay.
So, Doc, in that
So
case,
this is
you
one
can
of
see
the
that
procedures.
So for that case, Doc, you can tell parang her eyes before really look sleepy. Yung parang puyat or parang mapungay, like they've just woken up. But in the after picture, you can tell that they're much brighter. They look a lot more awake. And I'm sure that must help her greatly
Yes.
now.
Yes.
And then, Doc, is there also like a nerve palsy that parang yun din na yung pwedeng dahilan kung bakit nagkakaroon ng weakness sa muscle?
Yes, that is another reason why you could have a weak muscle, no? Is if you develop a cranial third nerve palsy, no? So there is a nerve that innervates the levator muscle, and if that nerve gets cut, whether it's by trauma or whether it's trauma to the brain, that disrupts the nerve impulses to that nerve or to that muscle, and so the muscle sometimes shrinks or undergoes atrophy.
Okay, Doc. So, let's say may isang pasyente na na-stroke siya. I've noticed na 'di ba parang nagkakaroon ng weakness on one side of the body. Usually, I think it's the left. So, pag minsan yung pati yung mukha and even the eyes, they have trouble kind of moving yung eyelid. And that's part of it. This is related to yung sinasabi yung cranial parang problem that occurs.
Yes, yes. So if the stroke involves the part of the brain that innervates the cranial nerve 3, okay, or is responsible for the cranial nerve 3 innervation, then they could also develop ptosis.
Okay. And then, Doc, dun sa sinabi niyong treatment, yung parang sling. So you were saying it's like a thread that you're threading into the eyelid. So para siyang window blinds, right? Para yung meron siyang string na pababa and you're literally parang pulling the lid up. So it just stays that way just to make sure na hindi sobrang nakasara yung mata. Parang ganun ba yun, Doc?
Yes, actually, that's a good comparison. It's like the blinds. The blinds have a string, okay. So that's how we suspend the eyelids up. But you see, when we suspend it, we also attach it to the eyebrows. So when the patient lifts the eyebrows, the eyelids can go up a little bit. So there's a little bit of function there.
Oo. So ang kailangan mangyari doon, medyo maingat na lang siya sa expression siguro kasi basta tumaas yung kilay, tataas din yung eyelids.
Yes.
Okay, so in that case, Doc, kapag tumataas ba yon, kailangan lang parang maingat na lang siya. So, kasi kapag tinaas yung kilay niya bigla, parang masyadong exposed na yung mata. So, does that mean medyo magdadry yung mata ng konti?
Yes, actually, when they close their eyes, sometimes they cannot close it completely. Okay, so sometimes we have to advise them to put lubricants inside the eyes when at bedtime. Okay, but most of the time, our eyeballs are or the cornea is protected because when we sleep, the
Mm-mm.
tendency is for our eyes to go up.
Yes.
See, so even though it's a little bit open, usually yung puti na lang ang nakikita, hindi naman yung
Oo.
itim no? So
Mm-mm.
that is a defense mechanism also of our eyes to protect them. And so, yes, but when we lift them up, they don't open very well, but they also don't close very well. So, kasi nakasuspend yan
Mm.
nakafix.
Okay. And then, Doc, ang mga surgery na ganito lang ba pwede sa adults lang or pwede rin sa bata?
Yeah, this condition can be also in children. So yes, we do it in children also. But of course, we have to anesthetize them and put them under general anesthesia. Um, in um, in adults, it is better uh, to do it under local anesthesia, okay? Because we need them to be awake, and halfway through, we can sit them up during the procedure and adjust the height of the eyelid. Okay?
Gising pala
So,
sila, Doc.
yeah, kasi mahirap naman kung bibigyan natin ng sedation yan, ng pampaantok, di ba? So,
Mm-mm.
if they're sleepy or groggy during the procedure, di na natin malalaman ano yung tunay na level or height of the eyelid.
So
So,
parang
mas
kailangan
maganda.
din natin malaman kung ano yung effect ng gravity. Kasi when they're seated up, then you can see exactly where it falls when they're looking at you.
Yes, yes. So that's why we have to sit them up during the surgery to make sure that it's even and that the shape is also uh, correct. Sometimes when they're lying down, we don't really notice the actual height, so it's better to sit them up.
Doc, ano naman yung lid retraction?
Okay, so lid retraction is the opposite of ptosis. If ptosis, you have drooping of the eyelids. Lid
Mm-mm.
retraction naman is yung sobrang mataas or sobrang nakabukas. Okay? So
Oo,
sometimes
oo.
we see these in patients who have thyroid eye disease. Okay? So usually if we see patients with a very big opening of the eyes, then we think of thyroid and we have to work them up for a thyroid problem. Okay? So, well, thyroid uh, uh, hyperthyroidism is actually a rather complicated disease. The thyroid gland produces a lot of thyroid hormones, which go to the different parts of the body and have different effects on the different parts of the body. Usually, they get yung mabilis yung heartbeat, okay, the tremors and sweating of the eyelids, no? And when the thyroid hormone goes to the eye, then you can develop a lid retraction, no? So usually, kasi what happens is that there's an increase in the amount of fat around the eye, an increase in the size of the muscles, and that pushes the eyeball forward. But part of that also causes the eyelid to retract. Okay, so that's where we what we call lid retraction. Okay, now one of the
Okay.
simpler ways,
Okay. So,
right? So like in this picture that we see here, the right eye is much larger than the left.
mhm.
Okay, and so sometimes it's a little bit tricky trying to bring the eyelid down, and so sometimes we do a little bit of a camouflage there. What we do is we disguise the lid retraction by closing the eyelid a little bit on in the corner. So sinasara lang natin ng konti dito sa kanto,
Oo.
okay? And then liliit na yan, okay?
Mm.
So we're
Mm.
not actually treating the lid retraction itself, okay? But we're closing the eyelid. It's like a little bit of a camouflage or
Oo.
disguising the problem. So as you
Oo.
can see here in the picture, what makes the lid retraction very obvious is the amount of white that is showing.
Oo.
Yeah?
Oo. Yes.
Okay?
Mukha siyang gulat.
Here, right. So here in the lower lid, what we did is we just close it a little bit, so there's not as much white showing anymore. And
Mm-mm.
and even though the center doesn't really go down that much, uh, the it appears like the eyelid is already smaller.
Hmm. So
And
kumbaga Doc, depende. Depende sa case. There are different ways para magmukhang tama or magmukhang appropriate yung nagiging itsura ng mata.
yes, this is probably one of our simpler techniques that we can use. No, of course we can. In severe cases, we need to really adjust the height of the eyelid already. But in mild cases, this is something that we can do. It helps also the decrease the exposure of the patient, because usually these patients, because the eye is very open, they have a lot of dryness, and so
Mhm.
closing it on the side helps the dryness, and it helps their appearance, and yeah, and it is also reversible, because when the thyroid levels become normal and the eyelid uh, would come down, then we can always open it up again anytime.
Hmm. So in that case, Doc, parang yung pasyenteng ito, kailangan niyang masigurado na yung thyroid problem niya is addressed with their thyroid doctor. And then, isabay niya yung treatment with ano yung bang pwedeng gawin for the eyes. So as
Yes,
nagre-recover siya, na-adjust based on kung ano
yes,
yung
yes,
needs niya.
yes, because just
Okay, I
fixing the
understand. So
eye,
ganun pala.
yeah, just fixing the eye does not fix the thyroid problem. So the patient has to have his thyroid problem treated, and at the same time, then we can do something also for the eye. Okay.
Okay. Okay. And then, Doc, I know that meron tayong mga other conditions that are a little bit more common. What is what causes it?
Okay. Well, um, blepharitis is actually an infection of the eyelids, and it is
Doc, yung
actually
for
uh,
blepharitis, what
a quite common condition. No, um, it could be an
Mhm.
infection of the hair follicles or some of the glands around the eyes. Okay, and this is actually quite common. So, like here in our picture, you can see like the morning when you wake up, you have a lot of muta,
Mm,
nagmumuta,
mm.
no? Or eye discharge, and it can accumulate along the lashes. Um, so this is usually an infection around the eyelids, and can be treated with some eye drops or sometimes ointments. Usually, we need to give an antibiotic in order to fight the infection. Um,
Okay.
Probably another thing we can do is to give some hot compress. Okay, hot compresses help also because they increase the blood circulation to the area. Together
Mhm.
with the blood comes the all the different antibodies and the white blood cells to fight the infection. Um, and Sometimes, if the swelling becomes worse and the infection would have a tendency to spread to other areas, then we need to cover also with an oral antibiotic.
Okay. So, Doc, aside from yung sinasabi niyong nagmumuta, what are the other signs na meron kang blepharitis?
Um, well, that is usually the main problem, no? But yeah, this flakiness, or like when you wake up in the morning, no, the eyelids are kind of stuck together.
Okay.
You can
Oo.
have redness of the eye, irritation. Um, you can also have itchiness. Okay, but if there's some itchiness involved, it may actually even be an allergy, no? But
Mhm.
and
Mhm.
sometimes you can, when you have swelling, okay, um, some of the glands can swell, and you can have what we call a hordeolum, or parang a sty or kuliti, no?
Okay. Okay.
So yeah, so sometimes the blepharitis can also um, turn into kuliti. Okay.
I see. So that's why it needs to be treated fairly quickly also kasi it can lead to other eye problems.
Oh yes,
Mhm.
yes, because infections can always spread, and if it doesn't spread to the eyelids or the surrounding structures, it may even spread to your eye.
Mhm. Mhm. And then for this pa, Doc, is blepharitis nakakahawa? Ano ba yung, aside from your saying it could be a matter of magpa-warm compress ka lang, how long would I have to put on the warm compress to help it?
Well, the when kasi when we say warm compress, it's always better if you see your doctor first, and
Mhm.
consult, no? Because um, first you have to be sure that it's really just a blepharitis, no? Um, so it's always good to consult. Okay. Um, I wouldn't want to give you advice as to how long to do the hot compress, because
Mhm.
um, it might get worse. If you do it for like 1 or 2 weeks, and
Oo.
you should actually have a consultation ready by then if it lasts that long. Yeah.
Mm, mm. So it depends on what your doctor's advice is on how long you can also do this kind of home treatment.
Yes. Yes.
Mm. And then
Um,
how about,
Anyway,
Doc,
we
yung
have a
mga
lot of we're available for teleconsultation, and so oculoplastics is usually the problems are very visible. So
mhm,
because they're on the eyelid or on the outside, not like other eye problems which involve the eye, and you need to look inside the eye in order to determine what the real problem is. So
mm.
teleconsultation actually fits our subspecialty of oculoplastics, and
Mm.
yeah, I think if patients have any eyelid problems, they can just come and do a teleconsultation with us. Of course, um, if we could do a little screening via teleconsultation, and the problem needs closer scrutiny, then you can also schedule a visit with us in one of our clinics.
Okay, that's true, Doc, kasi blepharitis at the very least kasi kapag ganito nag-uusap tayo on screen, you would be able to tell agad if there was something wrong with my eyes. Or I could come closer to the camera, mas kita nyo na parang oo nga, parang merong crusting dun sa eyelid or parang sobra na yung redness that could be a sign of blepharitis. And then, Doc, is having a lid scrub also a good idea if I am the type of person na medyo madalas magkaroon ng eye allergy?
Um, yes. Well, when we say lid scrub, we're usually using the ointment, okay, the
Mhm.
antibiotic ointment, and the way we apply it is by scrubbing the lashes with a
Hmm,
cotton pledget. So that's what we usually call a lid scrub. Yeah. Um,
okay.
there are uh, for some of the chronic blepharitis conditions, You can also use a little baby shampoo to scrub the eyelids.
Mm.
But I would suggest that you have a consultation first before you start doing that on your own. No?
Oo.
Mas maganda kasi if, if you have some medical advice with regards to that, if the doctor advises that, then that's fine. You can go ahead and do it.
Mm. So, Doc, for anyone that has, especially for a lot of people, kasi they're staying at home, they're working at home, or they're studying at home. So, what are some tips to make sure na a condition like blepharitis is something they can avoid? So, of course, I'm sure the first thing there is that you have to clean your eyelids well. So, when you're washing your face, make sure you're able to also wash the area around the eyes. But what else should they be careful about?
I think makeup also, but not maybe not so many people are using as much makeup as
Oo.
before.
Oo.
Because before, you would use a lot of makeup and sometimes even sharing the makeup with other
Yeah, yung
people.
mga brush.
You
Yeah.
can spread that to somebody else. No,
Mm.
now that's very taboo now, I guess. Huh? With the present setup.
Oo. Or baka depende 'to, kasi for some people, hindi na sila magle-lipstick kasi covered siya ng mask. But the only part you see are actually the eyes. So, dadaan nila sa eyeliner, sa eyeshadow. Baka it might actually be a source pala of irritation.
Well, yes. Uh, that's why our eyes are very important. Lalo na ngayon kasi yun na lang ang nakikita sa
Mm.
Zoom.
And then, Doc, how about for those that wear contact lenses? Like, is there anything that they should be a little bit more careful about?
Well, definitely, if you're having an infection around the eyes, it's probably not a good idea to wear your contact lenses. No? And contact lens wearers should always have a pair of glasses as a spare. So in case they, they, um, they cannot wear their contact lenses, like let's say biglang namaga or there's an infection, then they shouldn't wear their contact lenses and just um, wear the glasses. So they
Okay.
should always have a ready pair of glasses as a spare.
Para sigurado, dahil you're never sure what can happen.
Yes.
And then, Doc, you were saying that teleconsultation is a good way to kind of confirm whether a patient ka has a drooping eyelid or baka it's ptosis or possible blepharitis. So if I were to do a teleconsultation with you, ano yung mga preparation na dapat kong gawin? Like, anong dapat kong magawa before I do my teleconsultation? Like for me, if it were me, it's syempre ililista ko na what symptoms I'm feeling. But what else should I take note of?
Um, well, siguro, maybe you could have a list of other medicines that you've been using, other, yeah, basically the story of like the history of your condition.
Oo. So, kailan siya
Um,
nag-start mangyari,
yeah,
gano'n.
like when did the symptoms first start? Um, what have you done in order to relieve the symptoms? No?
Mm.
Um, is there any time where the symptoms are worse than other times? Okay, and if you have used any medications, how long have you? What are the medications you used? How long have you used them?
Mhm.
And yeah, so these are the usual questions that your doctor will be asking you. So if you
Okay.
could prepare the answers, I guess that would be better.
Oo. Doc, is a condition something like ptosis, something na you could that is common siguro, it could run in the family? So, for example, I have a parent or a grandparent na they ended up with that kind of condition. Is it more likely to happen din sa akin?
Well, ptosis actually, if it is inherited, if it is congenital or inborn, then it could also be passed down to subsequent generation. But
Okay.
if it is just like an acquired ptosis, then it's usually not not ordinarily passed down.
Okay.
It is usually due more to the process of aging. Okay, because as
Habang
we
tumatanda
age,
na lang talaga.
yes, as we age, our eyelid tissues, like the skin, the muscles, they kind of get
Mhm.
loose, and so that's the time that you can get the ptosis with
Mm.
age.
Siguro, Doc, it's kind of like all the other parts of your body that have muscles. So even, let's say, the muscles in your arms over time, parang nag-loosen din yon. So unless it's something that you're paying attention to, like kunyari, the muscles in your arms, parang mapapansin na it's loosening a little bit. So you have to pay attention to see if it's just part of aging or if there's something that you can do about it.
Right. I mean, there are a lot of other problems with aging. Cataract is one of them. Also, it doesn't mean that if your mother developed cataract that you will also develop cataract, because those things are due to aging, the process of aging. And yeah, well, speaking of aging, you can also
Mm-mm.
get lines around
Okay.
your eyes and eyelids, and that can also be treated with
Oo.
the Botox.
Mhm.
Yes. So yeah. So um, yeah, we what botulinum Botox is actually botulinum. Um, it's called
It's like a
botulinum,
toxin,
and
Doc, no?
uh, that can be administered by tiny injections, which relaxes the muscles. Because it relaxes the muscles, nawawala na rin yung mga lines around the eye. Okay,
Mm-mm.
so we do that also.
Mm-mm.
Yeah. And one of the conditions that we treat is blepharospasm. So if you have spasm around the eyes, then we treat that also, because the botulinum, or the injections that we give, will relax the muscles, and so the
Mhm.
eyelids can open again.
Okay. So for me, it's interesting though, kasi a lot of these cases nga, a lot of these conditions are related to aging. So, sinasabi nyo, as you age, the muscles kind of loosen, the muscles might loosen or detach. So all of this happens, you have to take care of the what you put into your body. You also have to take note about how your body is reacting to different things as you're getting older. So what I'm hearing though is that the good news is that for many so pwedeng simple lang siya, ganyan, laugh lines. Pwede pala siyang i-botox and they can go to you for that. Or if it's something that is more serious, the eyelid is down or the eye bags are too big or maybe they could have the twitching. Those kasi can be distracting. So let's say you're talking to someone, mapapansin nila, baka sabihin nila, bakit parang sleepy ka kapag kausap mo ko? Which is not the case. We are in fact having a medical condition na nakaka-apekto pala with the way that their eyes look. So for ito, Doc,
Right.
we're actually receiving a couple of questions from the people watching us. So from Miss Alma, ptosis and blepharitis are different from glaucoma.
Yes, they're different from glaucoma. Glaucoma is an eye condition where the pressure goes up inside the eye and can cause damage to the nerve, and eventually can cause visual field defects. Okay,
Mm-mm.
so you have your visual field,
Oo,
which
yung
is
lahat ng nakikita mo. Yes.
yung lawak ng nakikita mo, no?
Mm-mm.
And sa glaucoma kasi, parts of that visual field nawawala,
Mm-mm.
no? And the last one na mawawala is yung pinakasentro.
Mm-mm.
So sometimes you can have good vision, malinaw pa naman paningin ko, pero yung pala wala na yung mga paligid. Okay?
Okay.
And
Ganun ang
sometimes
glaucoma.
patients don't notice that,
Mm-mm.
which is why glaucoma is a condition that in order to catch it early, has to be tested. Kailangan talaga papasok kayo sa doktor, pupunta kayo sa doktor. Minsan sa silip-silip lang, no? Just by looking at the nerve, they really cannot detect it. There are more sophisticated tests now that can detect glaucoma, and you really need to come in. If you're a glaucoma suspect, you need to come in and have those tests done for us to really, or for, we have a lot of glaucoma experts um, here at Asian Eye, and we can refer you to one who's very good, and can give you a very very good checkup, no? Mas maganda yung magpapatingin na kayo habang maaga pa, patingin na kayo sa mga glaucoma specialist rather than waiting and then yung pala in the end meron pala.
Yes. And then, Doc, kasi with the way that this question sounds, yung pag-describe nyo kasi dun sa kapag nagnanarrow yung field of vision, kapag nagsasag yung eyelid, posible din na yung isang pasyente has glaucoma and also has the sagging eyelid. So parang ang nararamdaman niya, parang doble, mas maliit pa yung nakikita niya. Is that possible, Doc?
Yes, because sometimes the glaucoma patients, they have a very little, just only very little vision left. Then kung matatakpan pa ng eyelid yan, edi mas lalong nawala.
Oo. So parang nasa-strain na lang lagi.
Yes. But if you would come in for a checkup, even if it's for an eyelid problem, we will be doing a complete examination on your eyes to determine if you have any other eye problem. So that is the advantage of really coming in for the eye checkup.
Okay. And then, Doc, do you find na a lot of your patients, kapag dumarating sila sa'yo to consult about an eyelid problem, sinasabi rin nila na kasama sa mga symptoms na nararamdaman nila is sakit sa ulo or parang namamigraine sila?
Well, that's not really one of the more common problems or symptoms associated with with an eyelid problem, no? Yung headaches and migraines, when you say the patient has a headache, there's so many different causes of headache, no? And one of them would be a problem with the eye. Blurred vision is usually the most common. And sometimes patients would need just glasses, and the headaches may go away already. And these are one of the complaints that really require a thorough eye examination to determine what's really the cause. Okay, with eyelids. Problems with eyelids, we usually get more, like patients, doctor, sa gabi, napapagod na. Pag nagbabasa ako, parang pumipikit na ako kasi, napapagod na yung eyelids ko, gano'n. Okay, that's the usual complaint.
Oo, nagsasara yung mata ko.
With drooping of eyelids, no? Yeah.
Okay, and then here, Doc, there is one question here. I have a water retention in my eyes due to my CKD. Is there any remedy for this?
Okay, so this is a chronic kidney, no? You have a kidney problem. Yeah. Actually, kasi the water retention in the eyes does not really have anything to do with the eyes itself, but with the kidney problem. However, once the eye gets swollen, then it can also become a chronic problem because the conjunctiva around the eye, the area, the white part of the eye, it's called the conjunctiva. And if that gets swollen, it can bulge out. When it bulges out, it can then get dried up. And the conjunctiva is not meant to be dry. So once it gets dried up, it's very difficult to get it back inside again. And you have to. So we would be giving you lubricants and ointments in order to try to get that back inside again.
Okay. So it's another condition na kailangan nilang siguro in tandem, habang nagpapacheck siya dun sa kidney doctor niya, it's good to also consult sa isang eye doctor para ma-monitor. Sige, baseline natin to, i-check natin yung condition ng mata mo today, and then as nagpapatreat ka sa kidney condition, siguro na bumubuti yung kalagayan, i-check natin kung yung mata mo is staying healthy also, and it's not hindi siya lumalabas, hindi siya sinasabi niyo nagba-bulge out kasi yun ang iniiwasan natin. Ayaw nating yung mata mismo parang lumuluwa from the eye. Is that right, Doc?
Yes, yes. And actually, there are a good number of kidney conditions that are caused by diabetes, and diabetes also causes eye problems. So definitely, if diabetes is the cause of your kidney problem, you must really come in for an eye examination. Because if it can affect the kidney that badly, it's probably also affecting your eyes that badly.
Okay. And then how about this question, Doc? My problem is muscle twitching around the right eye and drooping of the right eye. Okay, so it's two things, Doc. Nagtitwitch na, nagdo-droop pa.
Okay.
So for a patient like
Okay,
that,
well,
Doc, that is experiencing both twitching and drooping.
yes, we will need to determine what is the real cause of your twitching and drooping and to see if they are related. Okay. For a patient like this, I would advise you to come in for a consultation because sometimes akala mo drooping siya, yung pala it's actually twitching. Sometimes very strong twitching can close your eye, okay? And you may think that actually it's drooping, pero actually it's just the twitching lang, okay? The other possibility is because you have had twitching for a very, very long time, okay? The muscles around your eye have come loose and kaya nagdo-droop na rin siya. So I would suggest if the twitching is very severe, you can come in. Maybe we can give you a little botulinum toxin around the eye, some injections, and then we can observe and see if the drooping goes away. Then that means it's really just caused by the twitching. But if there's still some droop after giving the botulinum, then most likely that you may need some tightening of the muscle there para mawala yung drooping. Okay.
Okay. Okay. And then here's another question, Doc. What if the hair of my eyelid enters my eye? What can I do?
Okay.
Hair na pumasok sa mata.
Are you able to see it? I mean, kasi sometimes the lashes come loose and then nakikita mo na lang nasa loob pala. So for those, you can try to remove it. Okay.
Doc.
But
Doc, what
if the lashes are still attached and it's scratching on your eye, then that's something that we need to address. Baka kailangan
Pero what if it's something like yung sinasabi mo, Doc, parang yun, parang nagpo-fold.
Yeah, because if the lash is poking on the eye, then we call that it might be an entropion
Okay.
or what we call trichiasis, okay, where the
And then,
lashes are really rubbing on the eye,
Doc,
and sometimes that needs to be treated. Yeah. So yes. So as I was
okay.
saying,
And
trichiasis.
then, Doc,
Okay,
there's
there are
a
a number
question
of things.
here. Are there any exercises that can be done to strengthen the eye muscles?
Okay, exercises for the eye muscles. Um, yeah. Well, I would just be
So,
curious. What would be the
paano daw
purpose
kapag
of?
muscles?
Okay. As far as eye exercises with regards to the muscles around the eye, I would probably ask
What if,
first,
Doc, kasi they were
what is
saying,
the
di ba,
purpose
parang
of the
as with
eye
any muscle in the
exercise?
body.
No? Kasi is it for the eye movements? Is it for the focusing? Is it for the eye movements around the eye? So there are many muscles around the eye that can be exercised. No, so yeah, I mean a little exercise is good, no?
Ah,
Lalo na yung for the
okay.
focusing from far to near. Maybe that can help your eyes to focus a little better, no? Um, yeah, but ordinarily, uh, we, a little exercise is good, but not too much.
So if ever, Doc, I've seen some people do this eh. So what they do is, kunyari, they'll look at an image, the image parang ganon, or they'll close their eyes for a few minutes, open it again, or idea being, basta't magalaw yung muscles in different ways as a way to kind of keep it healthy. Parang ganon yung narinig ko dito sa question na to.
Yeah, well, I think there's nothing really very scientifically proven about that, but yeah, like I said, a little exercise of your eye muscles is probably not going to hurt you. Pero not too much also, okay? Anything in excess is also no good, and anything too little is also no good.
Okay. And then, Doc, here's one important question. Siguro now that it is a pandemic, is it safe to visit a clinic para magpa-check or magpa-opera?
Um, yes, actually, here in Asian Eye, we have we have in place a number of protection for the patient. No, all our personnel are wearing protective gear. Our waiting rooms are have properly spacing, no, between the patients for proper social distancing. Um, our clinics and uh, um, consultation areas are constantly being cleaned and disinfected after every patient. So yes, we are maintaining all the precautions. Even everything is by appointment, and there's we do screening of patients before the patient can enter. We make sure that they are not having any showing any symptoms of illness. No? So I think yeah, their patients are quite safe coming for consultation. Reasonably safe. As far as surgery is concerned, yes, we do a lot of surgery now. We have some prior to surgery, we ask the patients to have antigen testing before they can come in for surgery. And our our clinic is not, we're a standalone clinics. We are not in hospitals. I think right now there are some patients who are concerned about going to hospitals because they think that there are a lot of the COVID patients around. But since we're in a standalone eye center, we're not exposed to the other internal medicine cases, no. So yeah, I think it's reasonably safe to come and seek consult in one of our clinics.
Okay. Okay. Worried about. Of course, kapag nagpapa-check up, be ready siguro, like even if you're gonna do a teleconsultation, kasi at least may options na. Kapag medyo
Right. I
hindi kayo
mean,
sigurado about sa condition nyo, dapat ba talaga magpa-check? Mhm. Pwedeng teleconsult muna.
yes,
And then,
what
if sabi ng doctor, di ba?
right. What we noticed kasi with during this COVID time is that a number of conditions can get worse because the patient is afraid to consult. But now with teleconsultation, you should, even though you're at home and you're afraid to go out, you can reach us through teleconsultation. No, so please do give us a call if you have any concerns, because we would not want your condition to worsen to a state where it becomes more difficult to treat.
Mhm.
So please uh, take note of the numbers and give us a call.
Okay. That's right, Doc. I think it's a good thing that they know that they can look for you, they can call you to ask some of the basic questions. Kasi one of the toughest parts of the pandemic is it's hard to imagine going out and then going to any eye center. So you make a good point that we are a standalone center, meaning kapag pumunta sa Asian Eye, hindi ka makaka-encounter ng pasyente na tinitreat for anything else kung hindi eye problem din. So wala kang ma-encounter na pasyenteng pang heart problem, pang respiratory problem, or any other part of the body. So standalone kami. And of course, lahat ng mga surgeries dito ay outpatient. So hindi ka matutulog in the center ever. Kapag nagpa-surgery ka, uuwi ka rin the same day. So you are less worried about any kind of exposure. And then, Doc, when it comes to, I think, some of the things that we discussed today, you were saying that it's important that you really get checked. Kasi wag mo nang pabayaan, wag mo nang hintayin na lumala yung condition mo. Kasi nga, a lot of problems, whether diabetes siya or high blood pressure or kidney problem, it can affect the way your eyes function. At ang mahirap kasi ngayon, lalo na naka-work from home tayo, halos lahat ng trabahong ginagawa natin usually sa office, kailangan through the computer. So very visual tayong lahat. Kung dati napapagod na ang mata, mas mapapagod pa dahil nga very visual ang trabaho natin kapag work from home. So it's good to be more careful. Siguro, Doc, when it comes to
Yeah.
certain tips, siguro, what would you recommend to patients who might be experiencing some of the symptoms of gantong drooping eyelids, but they're a little bit afraid? Like, what would you say would be good tips for them?
Yeah. Well, yeah, I think the first tip really is to seek some medical opinion first to see if there is really a medical condition behind it, behind the symptoms that you're feeling, no? And so I think that's where most people should really start is by seeking medical consult. Even though if you feel the problem is not um, a very significant one, it's better to treat it early rather than to wait for it to get worse. No? And yeah, Audrey, you mentioned that the function of our eyes are very important now because of the computers and everything is online. But if I may say also, because since everybody is wearing mask, the eyes are the only things that are seen, no? So even the appearance of the eye is very important now.
That's right, Doc. I think for me, that's something I've noticed. I've had people kind of look closely. Yung parang you encounter them, let's say, outside, nag-grocery, feeling mo kakilala mo, but you hesitate kasi you have to look a little closer at them to make sure na yun yung person that you know. Because the combination of a face mask plus a face shield really covers your face significantly. So it's very important, I think, that and it's a nice thing to think about na it's just one look at your eyes and someone can recognize you. I think that's an important thing to remember. And siguro, another thing is, huwag kayong matakot na magtanong kay Doc. Siguro meron kasi mga cases na parang nahihiya pa sila sa inyo or iisipin nila, ay, baka hindi naman important yung problem ko kasi syempre pandemic. The message of Doc here today is, for as long as you're feeling something, nakaka-apekto siya sa daily life mo, mas mabuti nang ipacheck kasi pwede namang i-teleconsult at kung kailangan talagang bumisita sa clinic, safe naman po ang pagpunta sa clinic. So those are the things I think that are important for us to remember. So Doc, thank you so much for spending your afternoon with us and sharing your specialization. I learned a lot. For instance, ang Botox, pwedeng pagawa sa Asian eye. Kunyari, laugh lines lang yan, pwede. And at the same time, it can be used for a case like spasm sa mata. And related rin siya even sa pag-droop ng eyelids, even as far as having drooping eyebrows. So these are some conditions na definitely nakaka-affect sa itsura ng buong facial features. Kasi na-imagine ko yun, Doc, kapag bumaba yung kilay mo, parang nagbabago kasing features mo, Doc, no? It really makes someone feel siguro like they have changed too significantly. They don't look as maybe as young or as fresh as they used to be. And considering naka-quarantine tayo, siguro ang gustong mangyari ng mga tao kapag nag-re-emerge ka, kapag pwede na makipag-meet with friends or family, you want to also look your best. You want to feel your best, you want to look your best. So it's good to take care of your eyes. It's also good to take care about the other parts of your face, including the parts of your eyes that can affect your vision. So thank you, Doc. Thank you for taking their time this afternoon.
Yeah, my pleasure. It was my
And
pleasure.
thank you to everyone.
Yes,
Thank you for watching us
Thank you
today,
very
everyone,
much.
on here Facebook Live. So everyone, please stay safe. Stay at home, teleconsult with us if you need it. We're always just a call away.